Yeah. So, when I started working with couples where there's a chronic illness diagnosis, I started thinking, we need some sort of a framework for this. Because what happens is when a chronic illness comes into the picture, grief comes into the picture. I mean, we have lost something. And most of us who have a chronic illness, that makes sense for us. But then we don't really think about how our partners have also lost a lot. They've lost their equal partner or their activities they used to do or just their perception of how they thought their relationship would go. And so from the get-go, there's a grieving process happening on both sides, and yet you're grieving kind of different things. And also people grieve differently. So you're probably grieving differently than your partner's grieving. And so you may not recognize right away that there's a grief process going on. So I do think it's helpful, first of all, to frame it as a grieving process because it's generally easier to have empathy when you know that someone's grieving, that their behavior, their words, their lashing out, whatever might be happening is
Hmm.
coming from a place of grief. And
Yep.
so if you can both recognize that, that's a very helpful starting point to understanding what you may both be feeling. And then acceptance and commitment therapy is the idea behind it is that we accept all of our feelings and the reality of our lives. Not saying that it's
Right.
okay, but just that this is how it is right now. So we're
Right
not
now.
trying to push away anxiety. We're not trying to get rid of depression. We're not trying to get rid of any feelings. We're completely accepting of whatever our experience is. But we're behaving in a committed way according to our values and not according to our feelings, right? So
That's
it's
huge.
it
I
is
like
very
that.
huge. Yeah. So if you think about it, most of us are sort of at the mercy of our feelings. So like if you're driving down the road and someone cuts you off, you're mad and somebody lets you in and you're happy. And, you know, acceptance and commitment therapy would be like, I want to be a kind person and I want to behave in that way. And therefore, whether I'm mad or happy or whatever's happening in my day, this is how I'm going to behave. So I'm not trying not to have those feelings, but I'm also not behaving from those feelings. I'm behaving from a place of a very value centered life. And so this framework can help many things, but I find that it really fits in well with with the experience of chronic illness, both from a personal perspective and also from a couple's perspective.
Do you usually work with the patient themselves first and then bring in the dynamic of a relationship, whether it's a marriage or a boyfriend, girlfriend, or,
Yeah,
a significant other?
it just depends. I mean, I do have a lot of individual chronic illness clients and I do believe that relationships can be changed one person at a time. So,
Yep.
I can work with them. I also have caregiver clients who come to me because they're burdened down with caregiving and all that. And then I can work with the couple and kind of weave in the individual work along with the couple's work. And so, we do all kinds of iteration. However it walks through my door, that's how I deal with it.
You'll deal with it
Yeah, yeah.
one client at a time,
Yep,
one patient at a
exactly.
time.